the little first aid kits are quite desirable, and they fit right inside those big pockets that many the young people wear today. And I was selling a lot of those, but a lot of the kids are skaters. And guess what? If you're doing skateboarding, you're going to need a first aid kit at some point or another. And they are, in fact, I think, a very good gift to give people, that little extra safety that might be there. But here you've asked for just $5. That's a very modest amount to ask.
And that's the goal, is that it's probably fairly affordable for most. And now obviously people are giving more than that if they're able to, and we're of course very grateful for that. But the other thing that we've noticed in this campaign is that we've been embraced by KEYT is a media sponsor. They're running public service announcements on their programs. Then we have all kinds of publications that have stepped forward and said, we'll embrace you. And some other nonprofits might say, well, why that and not us? And again, it's because of the universality of what we do and who we have an opportunity to affect. And it's a one-time deal this year. So we're very grateful and very appreciative. And the online donation, what we found is that people have been giving more than the $5, and that's very humbling.
So $5 is sort of a ballpark, but if everyone gave $5, you'd have more than enough to meet your needs.
Yes, and the needs. Now, something, Richard, that people might not know too is we have Connex boxes strategically placed throughout the county with up to 200 cots and blankets, so that if there is a disaster and we have to mobilize and open a shelter, we don't have to be schlepping East County, West County, or from Ojai to Moore Park or that sort of thing. They're there. If we can get more, obviously our ability to deliver services will be enhanced and improved, because we have our headquarters is in Camarillo, then we have satellite offices in Ventura, Ojai, and Thousand Oaks, and one is being built in Simi Valley in conjunction with a new fire station that's being built there. They're setting aside space for us there. So we really have penetrated the entire county, but obviously more cots, more blankets, more opportunity, because something that a lot of folks don't realize is if something bad happens in Los Angeles, where do you think those folks are going to go?
Yeah, that's a good point. They're going to come here.
Right. They're going to flee north. And so we have to be prepared to help them, because it's one Red Cross after all. So if they come, we're not going to say, are you a member? Do you live in the county? It's like, no, you have a need. The other thing that we don't pay attention to at all, and that's from up to down, we don't pay attention to politics, immigration status. And I know the Cruz Roja in Mexico is a government agency, and some of the folks from Mexico don't know that we're not, and so they're a little bit hesitant or leery if they avail themselves of our services. Does that mean that we're going to be looking for green cards or what their status is? We're blind. We don't.
The neutrality has been part of the whole organization from the very first.
Right.
And that's it. We're here to help people. We don't care what their political affiliation is, left, right. It's not the issue. It's the need.
Right.
Need is the big issue. That's one of the things that separates it from a lot of other organizations.
Yes. And people say too, well, the cross, isn't that have a religious overtone? And it's like, no, it's not. The cross is not a crucifix, and it's not a cross, because the up and down one would be longer. It's from the International Red Cross.
It's from the Swiss flag.
Right.
Yeah, so it's a reverse of the Swiss flag. The Swiss flag has a cross, but it's white on a red background, so it's kind of the reverse, white on a red cross. So that's where it comes from. But it shows its neutrality. That's what it's about. It's really a symbol of neutrality. It shows no preference to religion or point of view.
And I'm told that if we go into battle zones, especially in other countries, because one Red Cross is also one Red Cross internationally, so as you know, if there's an emergency somewhere like the Samoan tsunami, we deployed from the United States there. And if it's in a war zone, the Red Cross is a no-shoot sign.
Yeah.
You're sanctioned. You're there, and how many times I went to the Holocaust Museum in Washington, D.C. In June of 2009, and the only nonprofit they mentioned was the Red Cross was invited to see how the concentration camp inmates, if you will, were being treated. And, I mean, that's how well we're respected and revered in the world.
And that's for good reason, too. We've gone, I remember talking to one Red Cross worker who was deployed up into the Appalachian Mountains, and many of the people were doing illegal brewing of moonshine liquor. And that disaster area, they actually went up and said, well, we're not revenue agents, but we'll help you. We don't care if you're making moonshine or doing whatever you're doing. We're here to meet anyone's needs. Mm-hmm. And I think that's a great message. We're not going to take part in any gang war or any particular point of view. We're here just to help people in need. So it's a great organization in that regard, and it's proven itself over the years. That's what's so important.
And something else that we've been involved in more intimately than ever before is with this H1N1 pandemic.
Oh, really? How have you been involved in that?
We have been involved with the county's public health. So Dr. Levin has been working with our chapter in disseminating the messages. I happen to serve on a public information officers committee that's about disaster awareness for the county, and we work with county public health in that regard. I even was a guest on a program here at CAPS TV with Dr. Levin and Dr. Oster, speaking about the H1N1 and how we were all involved in supporting. Our Red Cross nurses are participating in the clinics that the county is giving with free immunizations for H1N1, because in reality it can become a disaster.
The great flu disaster of 1918 saw the Red Cross marshaled throughout the country to help in that terrible time. 400,000 Americans lost their lives, and a good portion of them were Red Cross workers who risked their lives to help others who were in need.
And I was just talking with one of our nurses the other day. She's involved with county public health from the American Red Cross perspective, and she was saying that she participates in all of the H1N1 clinics, and her husband actually got it, was very, very ill, and she said, so I decided I better get my shot too.
Sounds like a good idea.
Yeah.
Now, with the recent deployment of troops to Afghanistan that our president has said, have you seen an increase in people being shipped out? Or are there going to be an increase of people coming out of our local bases to go to the Middle East? I
don't know that for sure, but I would have to say my guess is yes, with them stepping
up.
Now,
when you're out there giving refreshments and whatever to the troops, do you receive any money from the government for that, or is again that all volunteer as well?
It's all volunteer. Another thing that we do, Richard, in that regard too, is we also have an office at the base. When I was mentioning where we have satellite offices, we have one at Point Magoo, so we're there. But something we do is if there's a service member's family who's affected in some way, it's our duty to get in touch and locate that service member, relay the information, and if need be, we make the arrangements and pay to bring them back to the county to be able to be involved with their family.
If there's a death in the family, right, or a birth or some
right,
other emergency.
Right. And again, without any aid. So there we are, finding them, communicating with them, and then flying them back, and that obviously costs money. And so that's something that I didn't know about before I got involved.
Again, there's always that need. But I can see the Red Cross is out there doing their work as they always have for over 90 years now. And so if people can help out, contributing $5 or more, I think it's a worthy cause of something that all of us here in Ventura County may, or hopefully may not, have to use in the future.
Right.
Again, thanks for coming on. And hopefully the campaign will be a great success.
Thank you so much.
Join us next time as we look into more of the nonprofits who do so much here in Ventura County. Until then, Richard Sennett signing off with Community Corner. Thank you and good evening.